TSH is the most common marker that's drawn when someone is suspected of having thyroid problems. But even though it's the most common thyroid marker, it still creates a lot of confusion for many people. That's why in this video we're going to talk about what TSH represents and also what causes TSH to go up and what causes TSH to go down. Hey guys, my name is Dr. Bodle, and in practice I help people use natural strategies to improve their Hashimoto's and hypothyroid symptoms. That way they can lose weight, improve their energy, and engage in life in a meaningful way. And if you like this kind of information, make sure you like the video, subscribe to the channel, and don't forget to click the bell. That way you're notified of new videos every single Thursday. So the big hang up and the reason why TSH is confusing for most people is because there's confusion about where TSH comes from. Yes, TSH is a part of our thyroid pathway and it's a proxy for thyroid function, but it isn't released from our thyroid gland. It's actually released by our brain. TSH stands for thyroid stimulating hormone, and if the brain sees that thyroid hormone levels are too low in the bloodstream, then it will increase the stimulating hormone to try to get the thyroid gland to make more and release more for our cells. It's for this reason, as a general rule, TSH is often inverse of thyroid function. When our thyroid function goes down, the brain tries to compensate by increasing TSH. Because of this, I'll often have people come into my clinic and say things like, my thyroid function is super high, and I'm having symptoms like fatigue, weight gain, brain fog, hair loss, and constipation. Now, if you've been doing research on how your thyroid works, that wouldn't make a lot of sense to you. If someone has really high thyroid function, why would all their symptoms be representative of low thyroid function? Well, the answer is they do have low thyroid function. They just don't understand exactly how TSH works. They probably had some testing done before, and they were told that their TSH was elevated. But because they thought TSH was a thyroid hormone, they thought the high TSH was associated with high thyroid function. So again, in most situations, TSH is the response from the brain in an effort to correct some sort of hormonal imbalance. Normal ranges for TSH are 0.45 to 4.5 milli-IUs per liter. And if your TSH starts to exceed that upper end of the range, then it's a good indicator that your thyroid function is likely starting to decline. Quick note here, I like to use a slightly narrower range of 1 to 3 milli-IUs per liter. And while you can't officially diagnose a condition based off those ranges, if we do start to trend above 3 or below 1, I use it as an indicator to help me identify trends that suggest your health might not be going in the right direction. And if we can correlate that with symptoms, then hopefully we can take action before things get worse. So if TSH increases when there's something impairing our thyroid function and limiting its ability to produce thyroid hormone, what sort of conditions can cause that? And what sort of things should we be on the lookout for? The most common cause of damage to our thyroid gland that then leads to a decrease in thyroid hormone and an associated increase in TSH is an autoimmune condition called Hashimoto's. Hashimoto's is when our immune system creates antibodies for proteins and enzymes in our thyroid gland. These antibodies are part of a coordinated immune response that damages and inflames our thyroid gland as our body responds to our gland in the same way that it would respond to some sort of an infection. Hashimoto's can be a little bit confusing because due to fluctuations in our immune system or changes in how active that autoimmune response is, at times when the immune system is more flared up, then it's possible that that TSH could increase. While at other times, when the immune system starts to calm down, the TSH might return back to normal. So depending on when your testing is done is going to affect the way that the TSH looks. A great indicator that someone might have Hashimoto's even before they ever get TPO and TG antibody testing done is that they have persistent thyroid symptoms, but their TSH is all over the place and it is poorly managed with medication. One other thing to keep in mind with Hashimoto's is that for some people, the immune response can be so significant and so severe that these flare-ups can break down and damage the thyroid follicles. These are the small chambers that hold thyroid hormone within our thyroid gland. And when these follicles break down, they can open up and spill excess thyroid hormone into the bloodstream. So even though Hashimoto's chronically is often associated with low thyroid function, in these short acute situations, for some people, it can present as a hyperthyroid situation. Suddenly, we have way too much thyroid hormone in our bloodstream, and our brain responds by saying, "Whoa, that's way too much." If I have too much, then what is the response? I need to turn down the stimulating hormone. So it will actually suppress TSH. In these scenarios, it's very common for these people to go into the hospital, have a number of hyperthyroid symptoms like racing heart, insomnia, sweating, and anxiety. And because the TSH is mildly suppressed below that lower end of the range, these people are usually diagnosed with hyperthyroidism when it's really Hashimoto's thyroiditis. Now, of course, we always want to be careful of hyperthyroid situations because they can be acutely dangerous to people. However, as someone has those acute symptoms managed, we also need to make sure to get additional follow up testing. That way, we can determine whether or not it was a Hashimoto's flare up or if someone has a true case of hyperthyroidism. So, yes, Hashimoto's can cause us to have an elevated TSH when there's long term damage and our thyroid gland can't produce enough thyroid hormone. It can also lead to a normal TSH if the immune system has calmed down and it isn't actively attacking our gland. And in situations where the immune response is very severe, it can also cause an acute spilling of thyroid hormone into the bloodstream, making things appear as though we are hyperthyroid due to the fact that the TSH is suppressed. Autoimmunity is often a moving target, and that's one of the reasons why it can be so tricky. Other common causes of low thyroid function that can lead to an increase in TSH include medical interventions like thyroid removal, radiation therapy for treatment of cancers in the head and neck, or even the prescription of certain medications like lithium, which can interrupt the way that our thyroid works. Other people can have low thyroid function due to general increases in inflammation, which our thyroid is very sensitive to. And this can be due to things like other autoimmune conditions in the body or even infections. Finally, some people can suffer from key nutrient deficiencies that are necessary for thyroid activity, and some of the most common ones include things like iodine, selenium, and iron. As I always like to point out, and as you may have noticed, while TSH can help us to identify if something's going wrong with our thyroid, it doesn't really tell us what. All we know from an increase in TSH is that there's a decrease in thyroid activity and a decrease in thyroid hormone. But to figure out what is causing that requires us to do some additional investigation into the patient's history and into their lab testing. So when people ask, "Dr. Brad, my TSH is high, what should I do?" My answer always is, well, we need to take those next steps. You need to follow up with your doctor and figure out what exactly the true underlying cause is. Yes, of course, some people are going to need medication, but whether you need medication or not doesn't change that underlying cause. And it's important that you do things to support that aspect of your health as well. Otherwise, it's unlikely that you're going to make significant and long term progress. But if not enough thyroid hormone causes our TSH to go up, then on the flip side, too much thyroid hormone must cause our TSH to go down. So, what causes an increase in thyroid hormone production? Well, once again, one of the most common causes that you should be aware of is an autoimmune condition. And in this case, it is Graves' disease. Now, although Graves can also have TPO antibodies and TG antibodies just like Hashimoto's, it also has antibodies that are unique to Graves itself. These are referred to as TSI, or thyroid stimulating immunoglobulins, or TSH receptor antibodies. And unlike TPO antibodies and TG antibodies, where they can lead to breakdown of our thyroid gland, thyroid stimulating immunoglobulins actually bind to the TSH receptor on the thyroid gland, and they make the thyroid gland think that the brain wants it to make more thyroid hormone. So TSI is almost like a TSH imposter. The thyroid gland's job is not to determine how much thyroid hormone our body needs. Its job is to listen to the brain and respond accordingly. So if it's getting a message from the brain, or if it's getting a message that it thinks is from the brain that is telling it to make more thyroid hormone, then if the thyroid gland can do that, it's going to do that. So in Graves' disease, these antibodies bind to that receptor, and the thyroid gland will produce thyroid hormone as long as that stimulus is there. This causes a dramatic overproduction of T4, an increase in conversion of T4 to T3, a significant suppression of TSH, and an increase in hyperthyroid symptoms. One of the reasons why Graves is dangerous is because it so significantly upregulates our metabolism that it can lead to heart racing and heart palpitations, and in some situations, heart failure. This is why I said before that hyperthyroid situations can be so dangerous, and we have to be very proactive if these things arise. The other thing that can also commonly cause a decrease in TSH is that other autoimmune condition that we just talked about, Hashimoto's. Like I said, both Graves' disease and Hashimoto's can have TPO and TG antibodies, so make sure that your doctor understands the nuances between the two conditions. That way they can identify what's truly going on and make sure that you're not put on some sort of medication or treatment plan that isn't appropriate for your body. Too many people with acute Hashimoto's flare-ups are put on Graves' disease protocols, which may be effective in the very short term when we are in that hyperthyroid state, but for obvious reasons don't make sense in the long run and can cause lasting damage. Other causes of low TSH include postpartum thyroiditis. Oftentimes the medical community looks at this as a transient form of thyroid disease, but in my experience, it's often an early sign of Hashimoto's that is brought on by the hormonal and immune changes that comes along with pregnancy. And if you want more information on how that process works and looks, I'll link for you my video on the topic. Finally, some people will develop what is called a toxic adenoma or a hot nodule. This is a growth on the thyroid gland that is walled off from the healthy tissue, and these abnormal cells are producing excessive amounts of thyroid hormone. In these scenarios, our antibodies will be normal, our TSH will be suppressed, but when we get imaging done like ultrasound, we can see those abnormal growths and then have them surgically removed if necessary. But just as we noted before, when our TSH was too high, in these scenarios where our TSH is low, the TSH is just a reflection of some sort of change in our thyroid gland. It tells us too much hormone is being produced, but it doesn't tell us why. And that's why, in any and all situations, TSH can be a helpful marker for us, but it's just the first line of assessment. So if you're having thyroid symptoms and your TSH is off, either high or low, that's when it's absolutely necessary that we take those next steps, dig into your history, do additional testing, run an expanded thyroid panel, and identify what the problem is for you. Because of the variety of causes that can impact our thyroid and therefore lead to a change in TSH, we need to be specific about the underlying mechanism because your treatment is going to be different than the next person's. But I hope that you found this video helpful and it provided you with some additional context and understanding to what TSH is and what can cause TSH to change. If you have any questions, leave them for me in the comments below and I will do my very best to get back to you. If you like this video but you need more help and you're interested in working with me one-on-one, either in person or virtually, then remember you can start that process by sending an email to contact@seattlethyroidhelp.com. And once my staff hears from you, they'll reach out, make sure that you qualify for a free consultation. And once they do that, they will find a time to schedule you and I to sit down, go over your health goals, and determine whether or not we can be a good fit to work together. If at the end of the visit, it makes sense both on your end and mine, we'll talk about what the next steps look like and we'll move forward together. If you'd rather keep learning on your own, then make sure to check out some of the other videos on the channel. Follow me on Instagram or Facebook for daily information and tips, or you can grab either one of my free downloads, which are listed in the description box below. But that's it for this video. Thanks so much for watching. Thanks so much for hanging out. I love you guys, and I hope that this information is helping you to make better choices for your health. If you did like the video, don't forget to give it a thumbs up and subscribe to the channel if you haven't done so. But my name is Dr. Bodle. I hope that you guys have a great rest of your week, and I will see you in the next one.